Hi, welcome to the Lifestyle Herbalist, the podcast where holistic wellness meets everyday living. I'm your host, Dami Vaccaro. I'm a registered dental hygienist, a clinical herbalist, and a certified health coach.
And I'm your co-host, Sabrina Cooper, a registered dental hygienist with a bachelor's in oral health promotion, a certified culinary nutritionist and herbalist, and a mindfulness and mindful eating coach. Together, we explore the intersection of holistic health, herbal wisdom, and joyful living. From plant-powered remedies to kitchen medicine, mindful moments, and conversations that feed the soul, we're here to help you feel vibrant, grounded, and inspired in your daily life. So steep a cup of something soothing, settle in, and let's grow well together one episode at a time, bringing you a healthy dose of happiness.
Welcome back to the Lifestyle Herbalist. Friends, I'm so glad you're here. Today we're stepping into a world that, well, if I'm being honest, many adults still fear just a little bit. It's about the dentist. But don't worry, we're not going to talk about root canals or that one hygienist who seems to be a little too excited about their ultrasonic scaler. But today we're going to talk about children and dentistry. I've had many questions over the years from parents who ask, well, what should I be doing for my child's first tooth? When should I make an appointment for them to come in? So today I wanted to talk to you a little bit about when to start the dental hygiene process, what to look for, and how to prevent more than anything else problems long before they even show up. So pour yourself some tea, buckle up your kids into the car seat, not the trampoline, please. And let's talk about setting some mouths up for success. So let's start with a big question parents are always asked. When do I bring my child to the dentist for the first time? According to the Pediatric Dental Association, age 1 or within 6 months of the first tooth eruption, whichever comes first. I know some people hear that and go, age 1? My child just learned how to walk. How in the world are they ever going to sit in the dental chair? Well, the answer is they're not going to sit in the dental chair. This is really more like a wellness check. We talk, we look, and we try to coach things along. We ask you questions like, well, what questions do you have? What are you noticing? How is your child dealing with having a little rag or a soft toothbrush in their mouth? And we just kind of coach things along because what we're trying to do is prevent. Nobody wants to have that child in the seat with a toothache or having to give anesthesia, or worst case scenario, taking them to the hospital under general anesthesia to do horrific things to those little primary molars. So it's basically, hey, welcome to Earth. This is how teeth work, kind of an appointment. We want to start early because it brings and builds comfort, and it builds rapport, and it builds trust. And it stops problems before they even start, which is way easier than fixing things later. So let's talk a little bit about what parents should keep an eye out for at home. Most people think about a cavity as a dark or a black spot, but the very first sign of decay usually isn't a black spot. It's usually a little white chalky patch just at the gum line, like the tooth looks a little thirsty. If you see that, it's not, oh no, it's, oh, we caught it early, because that stage is reversible with really good habits. Brown spots or visible pits mean that things are moving along and need some attention. And if your child wakes up multiple times at night, sometimes it's just being a toddler, but other times it's because their teeth hurt. And children are sneaky. They don't always tell you that something hurts because they think it's normal. So, children fall, children jump. Kids think that it's, they can just leap off a couch like they're auditioning for a Marvel movie. And if a tooth gets bumped, well, is it turning gray? Is it loose when it shouldn't be? Did it move or push into the gum? These all warrant a call to the dentist. Even if it's a baby tooth, baby teeth hold the space for adult teeth, and they really matter. So many times parents just kind of take a back seat to the primary teeth thinking, well, it's going to fall out anyway. Why does it matter? Why do I need to pay the dentist to keep that tooth in there. If the tooth is loose and the replacement tooth is just underneath of it, yes, let it exfoliate and probably it'll be fine. But if it's a toddler, it's going to be a long time before they get, a premolar or molar in, and it's going to be necessary to hold that space. Otherwise, teeth get really crowded and pushed around, and they might not come into the mouth appropriately in the right space. The other things that parents often miss is mouth breathing, and this is a huge one. This is a big one that parents often miss. If your child sleeps like a tiny little dragon with their mouth open, breathes loudly, snores, or wakes up with dry lips, that's a definite red flag. Airway issues can affect their sleep, their behavior, their immune health, and even the shape of their face and jaw. If you were to look online at the differences between children with mouth breathing versus nasal breathing, a nasal breather will have a rounder face. A mouth breather will have a more elongated face, crowding a vaulted pitch in the roof of the mouth. And even things like tongue ties, which many people don't think about either. Tongue ties are associated with mouth breathing because their tongue is supposed to be going to the roof of the mouth, and that allows the palate to expand. It actually tells the palate, hey, I need room. So the palate expands. When the tongue is anchored to the floor, the palate is not getting those messages. And so what happens is they end up with that longer looking face. I've seen kids change completely when their airway gets supported, and it's worth paying attention to. But the main thing to really think about is prevention. This is the main event. Now, the fun part, this is fun, and we can actually make it fun, but nutrition. Think about nutrition. Teeth are alive, and they need nutrients. We want to focus on mineral-rich greens, things like bone broth, grass-fed dairy if tolerated, and eggs with yolks. Please don't fear the yolks. They are basically little multivitamins. Veggies of any kind. Vitamins D3, K2, and magnesium. And while fortification can be good, we don't want to look for fortification in our foods. This means that they've been processed, which means they took all the vitamins out and now they're adding more artificial type vitamins to put them back in. We want to have whole, rich nutrients. And let's talk about snacks, because every parent feels that this is an energy shift. It's not just what your child eats, it's how often they eat. Snacking all day is like constantly marinating their teeth in sugars and acids. Instead, have something to eat and then have water. Have a meal, then have water. Give their teeth time to recover. The daily habit should be just wiping their gums even before the first tooth even erupts. You want to get them used to having something in their mouth to kind of clean things out. You want to start with brushing with a little toothbrush as soon as you see that first adorable tooth. Lift the lip up every week and check for early white spots. Keep the bedtime bottle for water only after age 1. And brushing, listen, I know some kids can act like you're trying to remove their soul with that toothbrush, but it's okay. Having some struggles with a toothbrush, it's much better than having them sedated in the hospital for a whole mouth reconstruction or removing primary teeth or putting caps and root canals on baby teeth. So much better having that couple minutes of arguing and fighting. Trust me. You can also make it a game. Use a song. Let them brush your teeth first. I set them up on the counter, put their head against like the wall or the mirror. Let them brush your teeth, and then you take a turn. You can brush their teeth, and you just take turns. But just be consistent. That's what matters. Consistency is key. And, you can support with herbs and holistic things. And this is where we get into my world. Using xylitol wipes or sprays for cavity-prone little ones. Using chamomile tea for teething fussiness. You can make a warm chamomile tea. Just dip something in there like a rag and just let them chew on the rag. It can really help with tooth eruption. Calendula gel for irritated gums. Nettle or oat straw tea for older kids to boost minerals. Mullein, elderflower, nettle for children with chronic congestion. Remember, we want them to breathe through their nose. Of course, taking age is appropriate into account as well. But nothing replaces brushing. Herbs are beautiful, supportive allies, but it's not going to replace the physical part of brushing teeth. Some of you have children who are basically tiny little step performers, and I've got some grandchildren who are just full out boogie. But we want to try and prevent trauma. So mouth guards for any sport. Don't let your kids run with pacifiers, toothbrushes, sippy cups, anything that is long or potentially can cause damage. Maybe you don't want to put coffee table out in the middle of the living room, just saying maybe keep things off to the side. And we want to prevent mouth breathing. Whenever possible, we want to encourage nasal breathing using humidifiers, saline rinses, allergy supports, either herbal or medical support, myofunctional exercises for older kids, and evaluations by airway-friendly dentists or ENTs. A child who breathes well grows well. And make sure you choose the right person for your child. A few tips to help parents choose supportive, child-friendly dentists is someone who sees infants regularly, someone who talks about prevention, not just fixing problems, someone who understands airway and development, and most importantly, someone your child feels safe with. If your child walks into the office like they're entering Disney World, you found the good one. So let's wrap it up. Children don't need perfect teeth. They just need to be supported. They need adults who teach them, model for them, and create habits that stick. Dental health is a whole body health. It affects sleep, behavior, immunity, confidence, and how they show up in their world. And the beautiful thing is that as simple habits practiced early can set them up for a lifelong wellness. So parents, caregivers, grandparents, teachers, you don't need to be perfect. You just need to stay curious, stay consistent, stay proactive. And if your child is currently chewing on something questionable while you listen to this, well, you're doing great, really. Thank you for joining me today on the Lifestyle Herbalist. If you enjoyed this episode, please share it with a parent or a caregiver who might appreciate these tips. Until next time, be well, breathe through your nose, and keep nurturing those tiny smiles.